screwed up all our lives. It's got us hoarding Clorox and Lysol, MTP beer has us all running wild.
It does. It's true.
I'm staying home, don't go nowhere to try and keep my brew from getting sick.
Hashtag quarantine.
But others don't follow the rules, they walk around like stupid little dicks. Well, the governor said stay home unless it's for something that you really need. Lots of people have stepped up to help their neighbors that may have special needs. And I don't believe I ought to be without my grandbabies all this time. My daughter said when this is done, a month-long sleepover would be just fine. Well, I'm wicked glad I don't have little kids at home and have to teach school.
Good song.
From what I can tell, there's lots of people that are losing their cool. All the seniors busted ass 12 years and now don't get to wear their cap and gown. And if this lasts too long, I surely will weigh 500 pounds.
Getting there.
Well, there's people going through the store, grabbing stuff until the shelves are bare. And by the time we leave the house, we're all going to have so much damn hair. My hair is so unruly, it really is too much for my poor comb.
Right?
But just the same, we're saving lives, so keep your little hairy ass at home. Well, Mr. Warner couldn't be here cause he took a dump and couldn't wipe his ass.
There he goes.
And if you drive by the house right now, you'll find him scooting his butt across the grass. And then you had the nerve to tell me you think that as a shopper I'm not fit. Well, this is just a little patent place and you're all toilet paper hypocrites. No, I wouldn't put you on because it really did. It happened just this way.
That's it, right?
The time we all socked it to Coronavirus USA.
Except for I'm in Canada.
You know we really socked it to Coronavirus USA.
So that's a song I got sent from someone, and I just figured I would share it with the world instead of just keeping it to myself. So understanding quarantine, isolation, social distancing in a pandemic. 3 ways to protect yourself without freaking out. Okay, well, I'm not going to tell you guys how to do that, because each their own. With coronavirus dominating the news cycle, we're starting to throw around words like quarantine and uneasy casualties. But what do these words really mean in your life? Quarantine doesn't have to be a scary thing, explains infectious disease specialist Stephen Golden MD, and it's an effective way to protect the public. Dr. Gordon complains the ins and outs of quarantine and other common terms are connected with disease outbreaks. What does quarantine mean? Governments use quarantines to stop the spread of contagious disease. Quarantines are for people and groups who don't have symptoms but are exposed to the sickness. The quarantine keeps them away from others so they don't unknowingly infect anyone. Quarantines may be used during outbreaks when there's a sudden rise in number of cases of a disease. Epidemics, similar to outbreaks but generally considered larger and more widespread. And what we're doing now is a pandemic. Larger epidemics, generally global in nature and affect more people. What is the difference between isolation and quarantine? Well, isolation serves the same purpose as quarantine. It's reserved for those who are already sick. It keeps infected people away from healthy people to prevent the sickness from spreading. Can you be legally quarantined? Is what the government's doing legal? That should never really be a real question. What a joke that is. According to the US Constitution, yes, the federal government can use the isolation and quarantine to protect people from a contagious disease. States also have authority to institute isolations or quarantines. Breaking a quarantine has had consequences that range from a fine to imprisonment. But government-mandated quarantines are rare. You have to go all the way back to the infamous Spanish flu pandemic of 1918 and 1919 for the last enforced large-scale isolation and quarantine, according to the U.S. Centers of Disease Control and Prevention. That was for a year, huh? Well, buckle in, people. We're in it for the long haul. In response to suspected or confirmed coronavirus exposure, some have been asked to self-quarantine, and while it's highly recommended that you do, these quarantines are currently voluntary. For anyone who has close contact with someone infected with the coronavirus, it's important that you listen to the instructions from your health department, Dr. Godin says. What is exactly close contact? It's defined as being within approximately 6 feet or 2 meters of someone with COVID-19 for a prolonged period of time. That includes you are living with, visiting, sharing healthcare waiting area room with someone with COVID-19, or if you have been coughed on by someone with the disease. So, in other words, the distance of one moose or 4.5 beavers for Canadians. You can do math easier that way. Health Department identify close contacts through what is called contact tracing. Dr. Gordon explains they will notify you if they think you've been exposed to a known case and provide you with instructions for the next steps. He says, unsure if you qualify of having been in close contact, reach out to your local health department. What happens if you are quarantined? Well, not all quarantines are the same. Look at the CDC for how best to do your part. Currently, the CDC recommends make a stay cat and avoid leaving the house unless absolutely necessary. Or call ahead, while your local state and health department will most likely keep tabs on your health. You may need to see your doctor too. First try a virtual visit, or at least call ahead first so the medical facility can take steps to prevent others from getting infected. Worried about Fido. At this time, the CDC says there is no evidence that companion animals, including pets, can spread COVID-19, but still be good to use caution if you've been exposed to COVID-19. Petting, snuggling, being kissed and licked, and sharing food during coronavirus quarantine. Have your own stuff. Don't swap unwashed dishes, drinking glasses, cups, eating utensils. Teaching people how to be clean is basically what we're doing. So I'm just going to skip ahead and let's read a little bit more about the news here. The coronavirus update, 2.2 million cases worldwide and 150,948 deaths. China revises Rwanda toll up 50%. 2.18 million on Market Watch, it says, to be exact. So this is a recovery thing here that we can do worldwide. The amount of people that have recovered in the whole world has been 565,864 plus 24,289 today. Oh, people, what are we up to? We're killing off. We're all dying. No one's getting better. I'm just joking. That was too outrageous. That was a little bit of drama. That was drama. That's what that's called. You know what's going on. Let's check out the closed cases. The closed cases, which had an outcome, was 721,470. Everybody got that. The closed cases. So basically, there are now more than 670,200 cases of COVID-19 in the US. Around 223,700 of them are in New York. According to the Johns Hopkins dashboard, over 33,300 people have died in the US from COVID-19 complications, and over 56,000 have been recovered. The US conducted around 3.4 million COVID-19 tests, according to the dashboard. Well, the states including Florida, Michigan, and Wisconsin and Idaho are announcing plans to slowly reopen, according to the New York Times. But experts are warning that premature decisions amid countries still lacking necessary supplies should be problematic, the Times reported. Total number of hospitalizations in New York going to tick down again. The Governor Andrew Cuomo says during his daily press briefing, the pessimists would say the curve is basically flat. Well, that's good news. An optimist would say we're on a down curve. He said the number of people requiring intubations has decreased, but the number of new cases walking the door of the hospital is still about 2,000 a day, and that is still very high. Cuomo said it's hovered about the same rate for several weeks. The number of deaths... Oh boy. Have unfortunately refuses to come down dramatically, he said. Yesterday there were 630 additional deaths in the state. That's what he said. Well, you know what, people? I'm getting on with my day now. I've got some TV to watch. I'm writing a book. The second draft. That's what I'm up to. You know, can't get drunk every day. I'm just teasing. I'm not drinking. Alright. Cheerio.